Yes.
All right, welcome to the first aid seminar. My name is Clark Oliver. I'm a showdown here at the dojo, and then also I've been a firefighter for 25 years, was a paramedic for 15 years. And Sensei has asked me to come teach a little bit about some basic first aid stuff that might relate to things that we do in the dojo. And I gave this a significant amount of thought, and I had, I was thinking, what sort of lesson plans can I do? And I came up with a conclusion that for what I wanted to show you, we're going to have to assume that you have nothing in terms of any equipment. This would be, for whatever reason, if you were hurt, if someone that you were with was hurt, for whatever reason you hurt your attacker with some of the techniques that we do here, and you wanted to take care of them, I don't know why you would. I can't address that situation, but that's a little bit about what we're going to talk about today. Just very basic stuff. Does anybody here have any kind of first aid CPR training at all?
I have an Eagle Scout.
Okay, so you had like the Boy Scout first aid. I used to teach that. I used to be a merit badge counselor for that.
Years and years ago, Boy Scouts, and I was in the Army.
Okay, right. Combat or life-saving buddy or whatever they call it.
Yeah, I think I had
combat life-saving.
I think I had CPR training I had some like 20 years ago.
You have some?
Yeah, I'm CPR.
Okay, excellent. All right. It's certified now. I think you're 80. That's good. All right, okay. So some of you have a little basic idea. For those that don't, let's talk a little bit about some vital areas. Let me borrow you for a sure thing. All right. All right, vital areas, and these are the things we're going to be attacking. And these are the points that if you have any sort of knowledge of anatomy, it really helps with this art. All right, so vital areas. We're just going to work from the top down. All right, the top, the front, and the back of the head is pretty invulnerable. But right here, the temples, okay, the bone's pretty eggshell thin. Directly underneath the temple is the middle meningeal artery. All right, and the temple is easily fractured with a hammer fist to the side of the head. All right, and you can rupture the middle meningeal artery, which is just underneath that, and cause what's a subdural hematoma, which is a bleed underneath the dura, said subdural, between the dura, which is basically the bag that the brain is in, between that and the actual brain. And of course, because there's nowhere, if that gets damaged and starts bleeding inside the head, there's nowhere for the brain to go except out through the hole, the base of the skull where the spinal cord goes. And as you can imagine, that causes severe brain damage. So that's one area. Of course, the eyes, everybody knows how delicate they are. The nose, whether we're attacking the side fist, back fist, chin jab, a blow there. There was that old Mythbusters should do this about having you struck underneath it, you drive the bone right up into the brain. I don't really think that's the case, but certainly a strike anywhere in this triangle right here is very devastating to the body. There's a lot of nerve tissue, a lot of vascular tissue in there. You get somebody anybody who's been hit there knows that it stops you cold for a little bit. Other vital areas right here are the temporomandibular joint, right here, TMJ. This is actually, there's a nerve that runs from the bottom of the chin and controls the lower lip. It runs right up and around the TMJ and up into the head. So this strike right here, this uppercut, boxer's uppercut, taps that nerve, and right back here makes the back of the jaw go on that nerve, which shocks, that's what causes unconsciousness. It actually shocks the brain. So there's another vital area right here. Of course, the teeth. Everybody has their own personal willies. Mine is broken teeth. Just talking about it just makes my skin crawl. I don't even like to talk about that. Here on the neck, all right. Of course, you got the trachea in the front, the larynx. It's very vulnerable to shots. That's why what is the first thing when anybody grabs you in here around the neck? What's the first thing we always do? You tuck the chin, protect your airway. A strike here can actually, like anything else in the body, if it breaks, it does what? It swells. If you break the voice box, it will swell and it will actually close off the airway. And you can't, it's a killing shot. You can damage someone. Strikes to the side of the neck will involve the carotid arteries, which run here. And of course, everybody that's here knows coca. All right, you're digging right into the carotid artery there. Also the jugular veins, there's an external jugular vein which runs over this big fat muscle that runs from the back of the ear, the sternocleidomastoid muscle. So I'm throwing all my anatomy.
We use them too.
This muscle right here underneath it is the interior jugular vein, which is the larger of the two, but they both will bleed very, 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 very rapidly. It's not like the carotid with the pulsing, but it's like a water tap. It will flow, and the blood will be, as it comes out, will be very dark. It's deoxygenated blood. All right. So any cuts right here on this side are very dangerous. This big fat muscle does protect the larger of the jugular veins and the carotids to some extent, but that's a very dangerous place to get cut, obviously. And the back here, of course, you've got the cervical spine, and the spinal cord is back there. Injuries to that area. Again, a little bit of swelling, a little bit of displacement of the vertebrae, and it can cause paralysis, temporary and permanent. All right, moving down the body, the chest itself is fairly well armored, I would say, with the exception of the short ribs. Good shot right under here to the short ribs. You can push that they're floating; they're not fixed to the sternum like all the other ribs. They can push in, and they can actually even pierce the liver with one. You get a good shot on the side. Boom. Internal bleeding. There's nothing we can do to internal bleeding. That man needs a trauma surgeon. A shot right here to the solar plexus. We've all had the wind knocked out of you. It's just a nerve cluster that's right in there. There are nerve clusters all over. There's a nerve cluster that's right in here, which is a rub point. Okay. There's nerve clusters back here, which is a strike point. All these places are all areas we can attack. Now, what sort of damage are we going to cause doing our techniques? All right. Well, just very, very simple ones. All right. Like Mikajo. All right. Yeah. And if anybody has any questions, just ask. All right. I'll be glad to demonstrate. Here we've got rotational stresses being placed on the arm bones, and we've got range of motion stresses being placed on the wrist. Okay, so wrist fractures right here. Doing this technique done properly with speed and force are going to cause some severe wrist and forearm fractures. Right? When we do defense against knife technique, we come right underneath. This is depending on whether you want to do a front snap kick or an oblique kick. I am not a kicker, so my choice is always the oblique kick, and I practice it enough that I can put it exactly where I want it to go. The knee here is designed like a hinge to bend in one way. It's not designed to bend that way. It doesn't take much force to drive it back, and the person collapses all the way to the ground. It's a very devastating fracture. They most likely will not ever walk properly again. Of course, they did try to stick a knife in you. So there's a little trade-off there.